but they said that you can't do this surgery on people who have fibromyalgia because this is a rheumatological disorder, not a nervous system disorder. So there was a little bit of a tussle there, and Dr. Rosner actually lost his license and a few things, and I won't go into any more of what happened through that, but basically what happened is there was this, almost like a 10 to 12, 15-year lull in research and stuff that was happening towards the cervical spine, because researchers are going to do research wherever there's money to do that research, and nobody was putting money into that. But there are a few things that started to come out as time went on. Dr. Daniel Claw, who is a leading researcher in the fibromyalgia field, you can't hardly type in fibromyalgia research without his name coming up all over the place. In 2005, he published a paper, and this was a little synopsis of it. He says, among survivors of motor vehicle collisions, persistent symptoms are common even after minor collisions, so it doesn't take much of a collision. And then he goes on to say a substantial portion of post-motor vehicle collision morbidity also includes chronic pain syndromes. It says whiplash-associated disorders are the prototypical pain disorders, but fibromyalgia with its more widespread pain can also be triggered by a motor vehicle collision. Well, how in the world can a rheumatological disorder be triggered by a motor vehicle collision or a whiplash? Okay, so that's something to start thinking about. Then the next guy to step into the arena is Dr. Andrew Holman. In July 2008, he published a huge study that was done over 4 years at different locations across the country at 4 different hospitals. And what they showed was that of these 1,100 patients, that 71% of the patients who had fibromyalgia have the cervical cord compression. And to put that into perspective, if you were to go out and pick 1,100 people off the street who don't have fibromyalgia and do this same stuff, it's right around 10 to 12% of those people who will have the same thing. And so he showed that there's this huge correlation between compression of your cervical spinal cord and fibromyalgia and the symptoms that are going on. The next thing I want to talk to you about is in the literature, as you're looking up things, there's something called forward head posture, because there's different ways to say this. Forward head posture is basically the loss of the cervical curvature. So if you kind of follow my cursor here, you look in this one person here that says 12 pounds, okay? You can see where the head is posturally sitting right above the shoulders, and that there's a curvature in the neck and then a nice curvature in the lumbar spine as well as in the thoracic spine. Then as you go to the next picture, as the head starts to move forward, you see that the neck straightens out and that person's head now sits in front of their body. This is called forward head posture. It's just another term for the neck has gone straight and now it's causing and stretching some of the spinal cord. And I'll go into that in a little more detail, but I just wanted to give you a visual of what this is that we're talking about, this forward head posture, okay? Because this is what a lot of the research coins this as. So Dr. Rene Callier is the director of the Department of Physical Medicine at the University of Southern California. So this guy has a lot of history behind him. In 1987, he wrote a book on whiplash. What I'm going to do is kind of pull out some of the things that he said and shorten them, of course. But this is a really wonderful book. If you wanted to purchase it, you can go on Amazon and buy it. But this will teach you a lot about your neck and how this could be causing fibromyalgia for you. He defines forward head posture, or FHP, as the result of losing the normal curvature of the neck. Okay, if you think of your neck, if you think of a banana, that's about the same curvature that your neck should have in it. Okay, and we'll talk about that whole banana analogy in just a second. What he says is that forward head posture leads to abnormal motion of the cervical vertebra, which is necessary for endorphin production. Okay, well, what he's saying here is that endorphins, if you know what endorphins are, these are the chemicals in your body that your body produces that block pain. And one of the main catalysts for producing these endorphins is proper spinal movement. Proper movement of the cervical spine bones, one on top of each other as you do motion. But if you've lost these curvatures, if your head is forward and your neck is straight, what happens is these vertebrae, they're now kind of stacked up and the motion is not there anymore. So without this motion, then the cervical vertebrae are not producing these endorphins. And so what he says is that many otherwise non-painful sensations are experienced as pain. And if you think about fibromyalgia and how you feel, all of these things that people don't hardly believe you that you're having pain with these different things. but you really are. And the reason is because you don't have enough endorphin production happening because you don't have the catalysts there that are supposed to be producing these endorphins. To give you kind of an analogy with this, if you think about a runner, okay, when they get running and they run for quite a while and they have all this motion going on in their spine, they start to build up huge amounts of endorphins in their bloodstream. So when they get to the point when they should be having a lot of pain, they actually get what they call a runner's high, where this endorphin production is so high it just basically gives them this feeling of euphoria. So instead of a runner's high, what I term what you have is a fibromyalgia low, because with a runner they've produced extra, with you're not producing enough, so that you've got all of these non-painful sensations which are actually responding with pain. He also continued and he says that this forward head posture depletes your lung capacity by 30%. How much energy does a person have, and how well does a body heal itself, and how well does the body function overall if you have 30% less oxygen coming in and out of your lungs every time you take that breath? And you'll notice, if you're all sitting here, in front of the computer listening and stuff, if you sit up really tall and take a breath, you'll notice how much more air and oxygen you can get versus the posture that you might have been sitting in, where your head is forward and this head is actually causing some pressure on the lungs, which makes it so your lungs are not being able to feel how they're supposed to. He also goes on to say that forward head posture can cause the entire GI tract, particularly the small intestine, to be affected. What he says is that in your intestinal tract, okay, you've got the smooth muscle inside of your intestines, and this is always pushing through bacteria, both the good bacteria and the bad bacteria, and the food substances and everything. That's always going and pushing through automatically. But when you affect the mechanisms in the cervical spine which affect that autonomic function, then it slows down this smooth muscle. And when the smooth muscle slows down, then that is going to keep those different bacteria in your GI tract. You're not going to break things down as good. You'll build up disease. You'll build up toxicity. Many people who have this forward head posture and fibromyalgia, they have a lot of irritable bowel issues, celiac disease, whatever terminology they wanted to call it, but there's usually some kind of intestinal inflammation going on and a lot of problem at the stomach. In 2005, in Spine, 6 orthopedists published this. And if you know what Spine is kind of like the orthopedic surgeon's Bible. This is a really, really sought-after journal to be put into. Well, in 2005, they published a study that says the impact of positive sagittal balance in adult spinal deformity. What that means is positive sagittal balance would be your head too far forward. Okay? If you have sagittal balance, your head will be normal and you'll be balanced right above your shoulders. This was a huge study done on 750 patients, and most of those were females, which is good for us because most fibromyalgia patients are female. What they determined was that using all of these different proven statuses for overall health, they showed that for every degree of curvature that a person loses in their cervical spine, that causes you to lose 1 full increment of overall health. Okay? We're talking your vitals, we're talking just your ability to work and function as a human being. Okay? And so for every loss of on a linear scale, meaning so if you lost 3 degrees of curve, you lose 3 increments of health. If you lose 10 degrees of curve, you lose 10 increments of health. Okay? So this is a pretty big deal to kind of show you how important this cervical lordosis is and how it can affect your body when you don't have this lordosis. In 1974, that Dr. Kaponji showed that this forward head posture reduces the flow of cerebral spinal fluid. Okay, if you think about your spinal cord, well, first of all, think of your spine. Then inside of your spine, inside of those bones, there's like a leather sheath called the dura mater, and that inside of that sheath then is fluid called the cerebral spinal fluid, and then inside of that fluid is your spinal cord. Okay, and this fluid is what keeps your spinal cord healthy. It's what basically bathes your spinal cord, and it pumps up through into your brain and back down and up into your brain and back down, okay? And so this fluid has 2 major things that it does. The first one it does is that it keeps things healthy. It's one reason why you start to get the brain fog when this is not pumping right, because your brain is not, the mental acuity of your brain is not where it should be, because you're not getting the nutrients you need from this cerebral spinal fluid, okay? But this is what Kaponji says. He says this forward head posture reduces that flow of cerebral spinal fluid. He says this loss of fluid circulation further compromises the protection of the brain and the cord. Okay, so what he's saying is this. If you think of a person when they're pregnant, okay, a pregnant woman will have the baby inside of them, and then surrounding the baby is all of this fluid. And that fluid is there as a protector so that if she happens to bang her stomach into the wall or something, that the baby is not harmed. Well, that's what this cerebral spinal fluid does as well. It creates this buffer around your spinal cord so that as you move your head and you put your head into different positions and things, that it's not affecting the spinal cord, that there's this movement and it's happening how it's supposed to. But when you have this loss or you have this forward head posture, he says the result of this makes a mechanically induced stenosis, or basically a mechanically induced dam, if you will,